So we will go ahead and place the eye pads on prior to skin extractions, especially since you're going to be using a bright magnification lamp light, and you don't want that to affect the client's eyes badly. So we are going to go ahead and do a basic extraction treatment for the skin of congestion, mostly blackheads. And even though our client does not have a lot of pimples, pustules, or sebaceous cysts, I'll give you, or show you rather, the technique that we would use if she did have a pimple. So we're going to go through this. We're going to normally do a cleansing and then use some type of exfoliation, usually an enzyme with steam, to soften up the keratinized skin, soften up the congestion. And then we would do about 10 to 15 minutes of skin extractions if needed. You really don't want to go over about 10 minutes because that can cause inflammation afterwards. After the extractions, we're going to use some high frequency to help destroy some of the bacteria, to calm the skin down. We'll use a little bit of blue LED. Blue LED is normally used over breakouts because it helps to create oxygen inside the pimple or inside the sebaceous cyst, thereby destroying the bacteria, because the bacteria inside a pimple is anaerobic. Propionibacterium, staph bacterium is anaerobic. Then we would normally do, once we clean the skin, with witch hazel or some kind of astringent, then we would do a soothing mask and maybe an antiseptic moisturizer. Although today we're going to cut to the chase and clean the skin and then go right for the extractions and do a little high frequency and blue LED afterwards. So let's get started. So you want to wear your gloves if you're dealing with someone who has acne, or you feel that they might bleed or they have a lot of infection. So we're using a gentle gel cleanser first. Make sure that we clean off all of the oil and makeup before we start the skin extractions. Remove this with some cotton rounds. And of course, after the cleansing, we normally go with some steaming. Sometimes people do steaming with the cleansing. I often do the steaming with the enzymes, or the enzyme, a bromelain enzyme from pineapple or a papain enzyme from papaya usually does the job. It's usually in a cream base, most of the time, sometimes a gel base. So we want the skin to be somewhat dry. And looking at our client's skin, you can see she has pretty clear skin. There's some breakouts around the chin area, a few blackheads around the nose area. She also has some PIH, which is the post-inflammatory hyperpigmentation from breakouts, and she has, because she's probably about a Fitzpatrick 4, she does tend to get some PIH here, which will eventually go away as long as she doesn't get more breakouts. So we would do steaming and enzyme next, and then we would go to the extractions. Normally what I do is I do focus on one side of the face first. Take no more than about 5 minutes to do one side of the face, 5 minutes to do the other side, and usually 5 down the center if needed. You don't want to over extract, and you don't really want to go over 15 minutes because then it can cause a lot of inflammation. So if you're going to work on the congestion, the blackheads, comedones in the nose area, you can either use a comedone extractor, and what you would do with that is you would come straight down the nose area, kind of rocking back and forth as you move along. Stop over the areas that are a little bit impacted. You can wipe. Our model here doesn't have a lot of extractions, but we're still going through the motions. With a metal comedone extractor, you don't want to apply too much pressure. You don't want to cause any irritation, inflammation, distension of capillaries. But you would just go straight down, rock back and forth as you move down and off. If you were going to use your fingers, you would wrap your fingers, of course your gloved fingers, in tissue, and you can place them side by side down the bridge of the nose, kind of rock back and forth, and then down. This is kind of the twisting method that I use, rocking back and forth and then twisting. Usually with the right hand you want to twist down. That makes it really easy. If you have a lot of congestion that is really hard to remove, the vibratory method often works, and that again is side by side with one hand slightly vibrating. You can see how that's helped right in here. For the corners of the nose, without actually blocking the nostril, you can apply a little pressure with your left hand, and then a little vibration. She's not highly congested. Now if you have a blackhead in the cheek area or any place else, again, both sides vibrate, or with the left finger holding still, the right one rocking back and forth, and then kind of in and down like this. Usually works really well. It loosens up the congestion. It's not too painful. And down like that. Now you don't obviously want to extract any sebaceous cysts, because often what will happen, instead of that instead of the pus coming up and coming out, it could quite potentially go down into the follicle and then expand the follicle and cause the infection to become worse. So you don't want to do that with sebaceous cysts. If a pustule is ripe, if it has a nice white ripe head on it, you can then again side by side rock back and forth, and that usually comes out pretty nicely. Again, side by side, down. Once you've extracted a pimple, you can apply a little bit of witch hazel to it. If it's bleeding a little, you can apply pressure for about 20, 30, 40 seconds until the blood clotting factors kick in. So she doesn't have the blood rolling down the face here. You want to keep your gloves on though. After extractions, again, no more than about 10 to 15 minutes for the entire face, but after the extractions, you can come in with the high frequency. You can either spark with the high frequency over pimples that are there but deeper, that have not come to a head, or you can also gently spark over areas that you've previously extracted from. We're going to do a little bit of high frequency. The high frequency should definitely not be too high. It should be not too uncomfortable. You want to make sure it's comfortable for the client. You don't want the client to have any contraindications like metal implants, heart problems, pregnancy, any issues like that, epilepsy. You want them to remove all of their metal jewelry before you spark the skin. Now you can either take the high frequency and you can apply a cheesecloth if you want to the face, gauze to the face, and then apply the high frequency down on the skin, and then run the high frequency across the skin for about 3 to 5 minutes over the entire face. Now here we don't have cheesecloth. You can use cheesecloth though to make this move a lot easier. You don't want to go over the thyroid. You don't want to go over the eyeball, even though it's closed. You want to do this for about 3 to 5 minutes. This helps to destroy bacteria. It's slightly soothing to the skin. This is actually called the direct method. There is another method called fulguration, but a lot of people call it sparking. Sparking is the layman term for fulguration. And if the client has a pimple or an area of concern, pimple or a sebaceous cyst, what you can do is you can hover over that pimple, just hover over it for a few seconds and count to 5. Is that too strong for you? A little strong for you? Okay, we'll turn it down just because we don't want it to be too strong. Hover over it again, count to 5. Tap. Hover over the pimple. If she has a pimple here, she doesn't, we're pretending. Hover over and tap. That tapping is just kind of to distract the nerve endings. It's almost like when you wax and you place your hand there afterwards. It's not as uncomfortable. And then you go to the next one. So it's 5 seconds, tap, 5 seconds, tap, 5 seconds, tap, and then you move to the next breakout. You don't want to over spark, because over sparking can cause post-inflammatory hyperpigmentation. Sometimes people think the more sparking the better, and they end up with the PIH, which is the post-inflammatory hyperpigmentation, because the skin sees it as a trauma. The melanocytes produce more pigmentation, and then you have brown stains on the skin. So again, about 3 minutes with the direct method, not going over the eyeballs, not going over the thyroid, and about a couple of sparks per pimple. This should take no more than about 4 to 5 minutes, in its entirety. And what you can also do is, if you have a really good professional strength blue LED, you can use blue LED. Blue LED helps to destroy Propionibacterium, also helps control an abundance of staph bacteria. So with the blue LED, you're going to make sure that the face plate is clean and sanitized. And you're going to go over the area and hold it over the area for several minutes. You're going to need to find out from the manufacturer of the LED that you're using how many minutes. If the LED is quite strong, you don't need as much time. If it's weaker, you need more time. Some LED machines are a full face plate where it comes down over the face. They have their goggles on. They should have their goggles on if it's going to cover the entire face. And it could be 5 or 10 minutes, it could be longer. Again, it really depends on the strength of the LED. Some LEDs are quite weak, and you may be here for quite some time, so it's important to use a professional strength blue LED, which is great for controlling acne, soothing the skin. It's very anti-inflammatory. After you are done with both the high frequency and the blue LED, you would go ahead and sanitize the skin with an astringent. You normally don't want to do a massage after extractions because you don't want to spread the infection around. You can use a soothing mask, maybe a hyaluronic acid mask, or some kind of soothing gel mask. Nothing really rich or creamy. Sometimes clay masks can be a little bit too much or a little drying or irritating. And then after the mask, an antiseptic moisturizer would be best.